Hello, we're going to present the interdisciplinary dentistry case presentation. Introduction. A 27-year-old woman came to visit the dental clinic. She complained about how her smile is not aesthetically pleasing, especially her frontal teeth aspect. There is a small diastema between the upper central incisors and the upper lateral incisors are conical in shape. The need for an interdisciplinary approach is identified because of alterations of shape and teeth position. Initially, photos, impressions, and radiographs were taken as part of the initial examination. These are the initial examination findings. Initial facial views, initial facial views when smiling, initial intraoral views, initial lateral cephalometric radiograph, and initial panoramic radiograph. Treatment planning. The problem of the patient isn't only the space between the upper central incisors and the conical shaped upper lateral incisors. The patient turned out to have a lower anterior crowding and an overbite of the frontal teeth. The more she need an orthodontic treatment in order to open and reduce the bite, increase the vertical dimension, and improve aesthetically the patient's smile before the restoration of the upper lateral incisors with two ceramic veneers. The orthodontist will be the one to perform orthodontic treatments with the aim to enhance the way the teeth and jaws function as well as the patient's smile or appearance. Planning an orthodontic treatment of the patient is the right way to fix the diastema, crowding, and overbite for the improvement of the patient's smile and anterior frontal teeth area. And once it is fixed and create the right symmetrical space, the prosthodontist will be the one to reconstruct the upper lateral incisors using two ceramic veneers. The ongoing collaboration and communication between the orthodontist and prosthodontist made them come up with a diagnosis that there are other important aspects to consider, such as the deep bite, the teeth inclination, and the lip support. Because the right way to improve the patient's smile is by planning an orthodontic treatment. It would also improve all other problems besides the aesthetic complaint of the patient before the reconstruction of the upper lateral incisors with two ceramic veneers.
For the procedures and techniques, the first part is the orthodontic treatment. One of the goals of this study is to correct the open bite of the patient by leveling the curve of Spee. According to the Alexander discipline, this goal can be obtained by using an anterior bite stop. This is done by applying two tiny orthodontic appliances on the palatal side of the upper incisors, followed by an application of some composite to increase the volume for a right contact with the lower incisors. To obtain more space in the arcs for the upper lateral incisors and for the lower crowding solution, reduction of retro-inclination of the upper and lower incisors was done through increase of anterior torque. This treatment was on a duration for 11 months, and an immediate retention with fixed splint from canine to canine was applied, both on the upper and at the lower arcs. Here we have the orthodontic progress and the occlusal view with bite blocks. The final lateral cephalometric radiograph and the final panoramic radiograph. For the bleaching protocol, before proceeding with the dental restoration, a bleaching treatment was done for the patient's request. 40% hydrogen peroxide gel was first applied, then a take-home whitening protocol with a 10% carbamide peroxide for 2 weeks was given. A DSD or digital smile design was performed for better visual. For a better communication with the patient, through the mock-up, we have created the shape of the wax up directly in the mouth of the patient. A light-cured resin and a transparent silicone was positioned in a standard transparent impression tray. This way, the light could pass through to cure the resin. The lateral shape is driven by the natural central incisors and the patient's desire. Here we have the final DSD. For the ceramic veneers and the clinical preparation, to perform a minimally invasive procedure, the silicone index was used. An animal thickness of 0.2 to 0.4 mm was removed only in some cervical and buccal areas, with every preparation edge rounded. After a careful cleaning of the preparation areas, a one-step impression with polyether material on a customized impression tray was taken. A temporary restoration was given, molded from acrylic resin. For the laboratory technique, before proceeding with indirect restoration, a model that accurately copies the tooth and its surrounding tissues is needed. The teeth was constructed to its natural dimension based on a palatal silicone index of the wax-up. The realization of the contour profile is simplified by the use of reference points marked with pencil. The animal ridge and the transition angle lines are reduced or sharpened by using a diamond burr. With the use of surface-colored powders, such as gold or silver, vertical and horizontal surface texture is created. After obtaining the surface texture, polishing was done by combining the use of both mechanic technique with diamond silicone polishers and glazing by oven. To achieve smooth and shiny surfaces, final polishing was done by using pumice powder or diamond paste. Here we have the surface texture of veneers and the surface finishing of veneers. For the veneers cementation, the following steps were taken as the teeth were prepared one by one: cleaning with pumice and water, etching with 37% phosphoric acid for 20 seconds with the adjacent teeth were protected with Teflon tape, and cleaning with water for 60 seconds. After that, primer and adhesive were applied to the teeth, and only adhesive on the veneers, which is already prepared with silane. Then, a light curing composite was applied, previously warmed at 55 degrees Celsius on the restorations. Veneer was applied to the tooth with a light, continuous pressure to remove all of the extras with a brush, scaler, floss, and plastic strip. After removing the excess, light curing for 5 minutes was done from every direction. Finally, a straight blade chisel, finishing strips, floss, and rubber polishers was used for smooth and shiny surfaces. According to the Alexander discipline, the final retention was made by a wrap-around retainer on the upper arc and by a fixed splint from 3 to 3 in the lower arc. Here we have the final facial views with veneers.
Results and outcomes. The right symmetrical distribution of the space for the upper lateral incisor is achieved. The lower incisors that once were crowding are now aligned. There are no changes of the vertical dimension. Inclination of the incisors was corrected, reducing overbite and better lip support. Good restoration and integration of upper lateral incisors with natural teeth, making the patient satisfied with her requests. Here are the intraoral views of the patient's mouth after 2 years follow-up. Here is the smile of the patient with her veneers. In this case, effective coordination between the orthodontist and the prosthodontist is of utmost importance. In the present scenario, the patient necessitates orthodontic treatment to address multiple concerns before the restoration of upper lateral incisors with ceramic veneers. The orthodontist's role involved opening and reducing the bite, increasing the vertical dimension, and enhancing the patient's smile aesthetics. By addressing the deep bite and increasing the vertical dimension, the orthodontist creates the necessary space and alignment for the subsequent placement of ceramic veneers. This prepares the dental foundation for optimal functional and aesthetic outcomes. The prosthodontist, in turn, undertakes the task of crafting ceramic veneers for the upper lateral incisors. The seamless collaboration between both specialists ensure that the patient's smile transformation is not only visually pleasing but also but also functionally sound. This approach is in line with the growing recognition of interdisciplinary dentistry's significance, where specialists pool their expertise to achieve comprehensive results. Conclusions. In situations requiring interdisciplinary collaboration, the essential starting point is the initial diagnosis shared among the team of specialists. This diagnosis enables a comprehensive understanding of the patient's challenges from diverse viewpoints. This approach aids in delineating the distinct areas of expertise and facilitates the formulation of an optimal treatment plan, including its sequencing and timing. Because of the collaboration between the orthodontist and prosthodontist, their collective diagnosis has prompted to consider additional critical factors such as deep bites, teeth inclination, and lip support. The collaboration of the two dental specialties in this case created a synergistic approach to dental care, combining their specialized skills for the best possible patient outcomes. This teamwork exemplifies patient-centered care that emphasizes comprehensive planning, functional harmony, and lasting aesthetic results. This underscores the significance of their collaboration as it ensures a holistic approach that addresses both functional and aesthetic aspects of treatment, resulting in comprehensive and successful patient outcomes. Here are our references. Thank you for watching.